Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience tuning in Mississippi and our online audience joining us around the world. We're glad you all could be with us as well. Well, as you guys know, COVID-19 has definitely impacted all of us, no matter where we live, but especially those that are immunocompromised have really faced some increased risk during this time. We're really excited since September is being recognized as Blood Cancer Awareness Month as well as Pediatric Cancer Awareness Month. We're going to be able to show you guys how you guys can be able to get some attention and also some care and information that all of us can use, whether you are a cancer patient, a caregiver, or a family member. During this next segment, we're excited to welcome Dr. Gwen Nichols to our program. She's the Chief Medical Officer of the Leukemia and Lymphoma Society, or LLS. We'll talk to Dr. Nichols not only about what LLS is doing during this time, but also where you all can go to be able to get some valuable information. Dr. Nichols, thank you so much for the time today. Really appreciate it.
Thank you, Cyrus. I appreciate the opportunity.
Oh, look, the pleasure is definitely all mine. So as I said, COVID-19, the pandemic, is impacting all of us. But how has LLS been able to support the patients, families, and even the caregivers during this time, Dr. Nichols?
Well, early on in the pandemic, people were just, everything was disrupted. And people didn't know, should they take their medicine, should they see their doctor, what was their risk? Well, we at LLS, we are a valuable source of information. So we had good, solid information that we could tell people about how to protect themselves, help them find places to get their care, and answer questions. And I think at a time of uncertainty,
I wanted to ask you, though, during this time, as I mentioned, especially those that are immunocompromised, they are finding themselves now facing some real risk then. So, how have you noticed, or how has LLS noticed, that the cancer patients have been impacted in general during this time?
Well, we've supported studies, Cyrus, that show that if cancer patients have the double whammy of a cancer diagnosis and COVID-19, they're unfortunately at much greater risk of complications of the virus itself and of dying from the infection. And so it's really important that we help protect our friends and neighbors who may have blood cancer, who may be survivors of blood cancer, but their immune system can't fight COVID the way others can. And one of the other things that really is important is to be sure that patients continue their care. And our doctors have found that some of the medicines that we have been researching to treat the blood cancers may, in fact, actually help treat the complications of COVID-19. So many of our researchers are pivoting their research to help treat infections in non-blood cancer patients. All the more reason those patients need to talk to their doctors and to LLS to be sure they stay on the right medicines and stay safe.
Right. Exactly. And I think you bring up a really good point for our audience here, Dr. Nichols, in the matter of making sure that they are taking their medication but also having the communication with their doctors. I mentioned in my introduction, Dr. Nichols, that not only is September recognized for Blood Cancer Awareness Month, but also Pediatric Cancer Awareness Month. So can you talk to us a little bit about what you all are doing with LLS to be able to support those that are dealing with pediatric blood cancer as well?
Absolutely. I think people know that the 1960s pediatric cancer that was a death sentence then is now 90% of kids can be cured of their pediatric leukemia. But that cure comes at a price and of health problems down the line. And so we want to make the discoveries that we have in the adult space the same kind of less toxic, more targeted therapies available for children. And so we are starting multi-million-dollar research and clinical trial effort for pediatric leukemia, the LLS Children's Initiative.
Wow, that is great news. And I also mentioned, even though, of course, the families and the patients are being impacted the most when it comes to those who are dealing with these different cancer diagnoses, Dr. Nichols, all of us can have a part, right? What can we do in supporting the work that LLS is doing?
Well, this is an important question. We really do need support. During this time, blood cancers have not gone away, and in fact, blood cancer patients need our help more than ever now because they have the double whammy of COVID and the blood cancer. We have many, many opportunities for volunteering, for fundraising, and we really would love to have your listeners help support us. We'd also like your listeners, everyone knows someone who may need some help during this time with the blood cancer, and I think if you can direct them to all the free resources that LLS has, we want to be sure people know about us and know that we can help.
Well, I think that's a great segue then, Dr. Nichols. How can our audience be able to find out more information about the work that you all are doing?
Please go to lls.org or call our information specialists, 3 master's level oncology professionals, at 800-955-4572. We have all kinds of free support information and just what you or your loved one may need.
All right. So LLS.org is that website. Make sure you guys take advantage of that, or, of course, the number there. Dr. Nichols, I really appreciate you stopping by the program. This is such an important topic, as I said, because all of us are impacted in some way or another. We know someone who is, so it's great to be able to spread this information. And I look forward to having you back on the program again, Dr. Nichols.
Thank you so much, Cyrus. Really appreciate the opportunity.
Oh, the pleasure is definitely all mine. And we thank you, our audience, for tuning in to another great segment of Conversations Live. As I said, September is recognized as Blood Cancer Awareness Month as well as Pediatric Cancer Awareness Month. So make sure you guys do visit lls.org for more information about not only what your loved ones need to know, but also what you can do to make a difference. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live today. Let's make it a great one.